how are these owners going to feel like when they remember their dog was in pain, their dog was healing, recovering, but all they can think about is they had a rose bandage art, a smiley face, something that kind of brought a little positivity to this stressful and scary time for them. And just to see that little bit of extra care, it goes an absolute long way.
Hey y'all, you're back and I'm so glad you are. We've got another great VetFolio Voice episode for you. This was such a cool episode, such a fun guest. I was joined by Brian Goleman. Brian is a licensed veterinary technician who is not only perfecting the art of bandaging, but also sharing everything he's learned with the rest of us. If his name sounds familiar, you might know him from his website, briansbandages.com, or from social media, where he posts tons of continuing education, along with pictures of beautifully crafted bandages. In this episode, we definitely get into the technical aspects of bandaging, different materials, common complications, and breed variations. But perhaps more interestingly, we dive into the psychology of bandaging. We talk about how a well-done bandage influences client perception and helps reassure pet owners about the care their pet's receiving. I know I've certainly seen this firsthand with surgical incisions. You can perform a surgery flawlessly or manage a wound or fracture brilliantly, but at the end of the day, the bandage or the incision is what the pet owner sees. That's really what kind of shapes their perception about the care their pet received. So, if you want to learn more and see some truly beautiful bandages, I highly recommend checking out briansbandages.com or following Brian on social media at briansbandages. Let me go ahead and wrap up my comments because, like I said, this was a really fun episode and I'm excited to get into it. I'll tell you a little bit more about Brian and we will talk about it. Brian is a licensed veterinary technician with a passion for teaching and perfecting bandaging techniques. With years of experience in general practice and emergency settings, he founded Brian's Bandages to help veterinary teams master effective, stress-free bandaging. Known for his engaging teaching style and practical approach, Brian is dedicated to improving patient care through better bandaging.
Are you passionate about animals and love helping people? In the fast-paced world of veterinary medicine, exceptional client communication is just as important as quality pet care. As a customer service representative, you're the heartbeat of the practice, the first and last person clients see. You provide comfort, support, and trust in every interaction. This course is designed just for you. It's interactive and practical, featuring real-world in-clinic video scenarios, engaging knowledge checks, and printable resources to give you the tools, confidence, and strategies to handle any challenge and elevate the client experience. Register today for the Certified Veterinary Client Service Representative course on vetfolio.com.
Well, I'm super excited for this episode to welcome Brian Goleman of Brian's Bandages. If you haven't found him, either his website or on Instagram, I highly encourage you to go check it out. Such cool bandages and then a lot of education around bandaging techniques. So Brian, thank you so much for joining me.
Thank you so much for having me. I've been looking forward to this conversation for a while, so let's get into it.
Awesome. Awesome. Me too. And, we kind of have a general idea of like where things were going. But then ironically, like we started into this conversation before we hit record about improv comedy and exam room communication, which I think actually fits nicely with some of our talk here because something that you've mentioned when you talk about bandaging and such is kind of the psychology behind bandaging. So can we start there? Can you talk to us about that a little bit or about improv comedy? I'm good with
Yeah,
either one.
I mean, all kind of blends together really. Like when are talking about the psychology of bandages, you are talking about really getting owners to buy into what we're doing here because like I'll bandage a leg for it'll probably take me like 45 minutes to do wound care and then bandage and then the dog goes home and then he does most of the recovery at home. So if the owner leaves my clinic not really understanding what they're doing or like not being having clear communication, they think that's when things go wrong. So if you can get an owner to buy in and be part of the team in recovering this animal, it really is a special thing that needs to happen, or else the patient will get bandage sores or leave the e-collar off or like get into trouble, stuff like that. So to get this patient healed quickly and efficiently, like the owner definitely needs to be on board. And I do think that you kind of gotta do some Jedi mind tricks with them because they're scared. Owners are scared. They're confused. They are worrying about their family member. And so trying to use some improv comedy or something like that to lighten the mood, use bandage art, use clear, not complicated instructions, like stuff like that, that kind of gets them on board.
Sure, sure. And I mean, they're scared and it's not unfounded. I mean, it's to send a patient home with a bandage can be a little bit nerve-wracking as well because bandages can come with their own set of complications. You don't know how the owner is going to take care of this bandage. And I know that has led me into like over-explaining mode before, which I'm sure is not helping to calm clients' nerves in that moment. You know, placing a good bandage and then also, like you said, kind of using these Jedi mind tricks to help make things feel a little bit safer, a little more comfortable seems really important. I'm sure you didn't, just walk into veterinary medicine and say, bandaging, this is what my passion is. How did you become interested in bandaging and kind of learn about these techniques and the psychology behind them?
In a weird way, I kind of did that.
Awesome.
In the weirdest way. I was actually started as a zookeeper in South Carolina for 3 years. And then I moved up to DC to be with a girl. And I am an impulsive human being and didn't have a job when I moved up here to be with her. So I just started cleaning cages at the hospital I currently work at. So just fell in love with it, just kind of the energy of it, working with dogs and cats, and fell in love with the people in this building is also really, really special and makes you want to come to work. But then I moved up through the ER and became certified vet tech and then moved up to specialty surgery. Had never done a bandage before in my life. Went up there, really liked the people I worked with, and just jumped into it and figured out how to bandage an animal. Tried to get my hands on as much CE as I could. I just wanted to do a good job, and I really found that there wasn't too much out there. And I was bandaging like 5 or 6 dogs and cats a day, so had to do a good job the first time. And so I basically built all these techniques, these communication techniques myself, and want to share it with everyone because I feel like there is a kind of a lack in CE there.
Wow. I mean, that's awesome that you walked in and kind of, said, "All right, let's do this." That's fantastic. So you mentioned looking for CE, wanting to do the best job that you can on these bandages and not finding a ton of CE out there. What kind of bandages were you doing? Because when I'm thinking of bandaging a limb or something like that, that I think that is a learned technique that kind of comes with experience to a point of, not wrapping it too tight, but not letting it slide off. And especially if you're using any sort of device in that bandage, like a splint or something like that. So, how did you learn how to place these bandages?
Well, I had a really good teacher before me. He was my mentor. He taught me so much. And then I took what he taught me. And when he left the hospital, I was seeing dogs, cats, greyhounds, bulldogs, golden retrievers, old dogs, young dogs, puppies. And the CE that I was finding online was more straightforward as this is how you bandage a dog. And that was helpful, but I was finding that some techniques weren't working on some breeds or some ages, and it worked for others. And I was really just trying to find what worked for what animals. If this happens, what do you move on to? Like kind of point A to point B being fluid. So I was really just, it was mostly just experience, as you said, like hands on. I have the numbers, I'm seeing the quantity, and just trying to figure out if like a bandage sore happens here, and I'm noticing it happens on greyhounds a lot, then kind of how I bandage a greyhound is slowly becoming different than how I bandage an old bulldog, you know? So just kind of knowing what you're looking for, being fluid with your bandaging and just being able to adjust if certain things come up. And it was mostly just experience at that point. And I know a lot of practices don't have the ability to have the numbers that I do. And so this is why I'm trying to like get this information out there.
Absolutely. I love that. I love that you mentioned the numbers because I think that that makes a huge difference. I have placed my fair share of modified Robert Jones bandages, and I feel pretty comfortable with that technique. I was able to place a lot of them before I went to vet school, and certainly after I went to vet school. However, when I don't do it for a long time, it's a little clunky when I first get going. And I've certainly seen what you are talking about when you say, oh, there's different breeds and you have to adapt your bandages to the different breeds and such. Because I think I've run into that, not realizing that that's what was causing the problem. And I don't know that I've really known how to adapt that bandage. So I love that you're kind of creating this resource to get the information out for, say, someone like me who says, I'm very comfortable with this bandaging technique, but it's just not working on this patient. And maybe some considerations for why and how to make it better, because you're right, a lot of us, we won't have the numbers to learn that ourselves.
Yeah, and every wound is different, every injury is different, every animal is different, every owner is different. There's just too many variables that go into it to where you can say simplify it like this is how we do things. Because again, might not work for someone else. So even when I'm explaining these techniques, I always say this is what I do or this is what I would do. I might not ever be in the room with you or see the animal or see the owner. And so even what I'm saying might not work in that situation. So it's just you kind of got to read the room in a sense, but just be have these tools in your tool belt and just be able to be flexible in that way.
Isn't it the what works in your hands kind of technique? I
Absolutely,
think there's
absolutely.
a lot of legitimacy to that. But information is what we need of what does work for you and maybe what does work for this other person so we can find in our hands what's going to work the best for that bandage.
Yeah, absolutely. And same with like talking to owners. Like if I get a greyhound that needs a bandage, I basically will tell them that they will get a bandage sore. Like it just
Sure.
they have such thin skin, they don't have a lot of muscle or fat as padding, and they typically need to be bandaged for a while because they have probably an RU fracture or something like that. So just letting the owners know that we will probably get bandage sores. It's not the end of the world. We'll stay on top of them. And if we don't get them, then they're super thrilled. But if we do get them, at least they're mentally prepared.
And I think that's really good information to put out there to veterinary professionals because I could see myself trying to bandage, an RU fracture and seeing a bandage sore. And I probably would take that on myself and go, oh gosh, I let it rub. I did something incorrect. So to have someone out there saying, hey, this is a really common complication in these breeds. So be on the lookout for it. Do the best you can. But if it happens, know that it happens a lot. I think that would do a lot for me as far as confidence goes, and then client communication to warn people ahead of time. That sounds hugely important.
And I think that's the biggest thing when people are scared to put a bandage on. It is unnatural. It's an extremely unnatural thing to happen to bandage an animal. Like they don't know what's happening. It's not supposed to be there. And so stuff's gonna happen. You might get a bandage sore. It might happen. It might slip. It might happen. Like, but there are things that we can do. Like they're not alone. It's never 100% someone's fault. We're always learning. And so the best thing to do is like try and figure out if something happens, how do I prevent this next time? Look around you, look what's on the drawers. If you have stockinette, if you have extra cast padding, if a bandage gets wet, how can we make it dry? Like stuff like that. Just being able to be creative and kind of flexible in that way, like we've talked about, and because you're here for the patient, and also just talking with the owner, checking in, make sure they are activity restricting like that. Do we need to up the sedatives? Like just look at the whole picture. Don't just look at the bandage sore. Look at how we can prevent the steps that were leading up to the bandage sore. Because if they were being overworked at home or jumping up on the bed and running up and down stairs outside, then that bandage sore might not have ever happened. So it's okay to feel a little guilty. That's totally normal, but it's also okay to like keep going and keep trying and keep growing.
And seek out continuing education like Brian's
Absolutely.
Bandages and
Oh
learn how to
yeah.
do it.
Message me all the time. I really like talking about bandages. So
That's awesome. I feel like I have to throw this out here when you talked about upping the sedatives because the dogs are running around and such, because I think that's so common when we're dealing with bandages because a lot of times this is a long-term thing and clients can have a hard time keeping pets still for that long. And I get it. I've been there as a pet owner myself. So I have this spiel that I will give to clients when we're discharging from certain surgeries where I'll say, we have this. It's usually gabapentin and trazodone for me, but whatever sedative cocktail you're using, and I'll say, here's how I see this going. First couple days, like they're a little slow moving and they're kind of getting back to normal, and you're like, this isn't so bad. This is fine. I don't know what they were so worried about.
Hmm.
Then, like, day 3 to 5, they start to kind of get back to themselves, and you're like, this is what they were talking about. Okay, I'm going to give the medication. Day 7 to 10, you start to feel guilty about giving that medication. You're like, I'm sedating you. It's been a little while. Should I keep doing this? I feel so bad seeing you so tired. I'm like, that's when you hear my voice in your
Yes,
head and you give the sedatives.
absolutely. And I am also not afraid to like scare them a little bit. Like I feel like they need to have a little bit of fear. And I'll tell the owners, I was like, it's you're gonna feel a lot worse if they aren't activity restricted and they re-injure themselves. Like
And
it's
yeah.
it's gonna be worse for the patient, it's gonna be worse for you, and then that's more work for me. So so I'm trying to do us all a favor and just kind of put a little, just know the repercussions of what might happen.
Yeah, and I don't that doesn't sound like scaring him. I mean, that might be kind of a natural effect that kind of gets to the desired outcome, but that sounds like just being honest of,
Yeah,
look, if this doesn't work out, we might have to start from square one, and that can or further back from square one because now
right.
we have bandage sores and other complications that we're dealing with.
Right. I totally agree. I think just in summary, bandages need that clear conversation with the owners because they are part of the team, and you wouldn't leave a member of your team out of the conversation and the plan moving forward with this pet. So it's very important to have that clear line of conversation with them.
And I think that kind of goes back to the psychology piece, which I do want to circle back around to. But before we do that, I'm curious with like some of the technical aspects with bandaging. Aside from, maybe what we'd think of gauze and roll gauze and cling and vet wrap and elasticon, things like that. Is there anything when it comes to bandaging material that you're like, this you should absolutely have in your clinic, or anything where you're like, everybody uses this and it doesn't work, you should do it differently?
Ooh, that's a fun one. We'll start with the less controversial one.
Sure.
Stockinette is something that I use on basically every bandage. I use it at the top of the bandage because it reduces rub. It looks pretty. It just makes it look a little bit cleaner. And having my bandages be aesthetically pleasing is back to the psychology of it. It needs to look quality. So having a little stockinette at the top creates a nice little cushion and just makes it look prettier. I also roll them up and use them as like donuts, like just little cushions. So perfect for pressure sores. It circles right around the pressure sore, makes that surface area a lot bigger, and then cushions it. So by the next time, typically it's healed. And then the next must have it, I really like Medipaw. It's a bandage cover product. It's waterproof, rubber soled, great for grip, has adjustable straps around it and at the top. It's built to protect a bandage when it's outside. Hashtag not a sponsor, but I do absolutely love this product. Every bandage that goes home out of our hospital has one. I don't like the fluid bags. I understand why people like them. I don't like them because I worked really hard on this bandage and I will not cover my artwork up with something that's recycled. I want to make it professional. I want the clients to know I know what I'm doing. I'm setting you guys up for success in the best way possible with this bandage. And they're awesome. Like typically I'll just tell people because a lot of people are they don't like the price of or adding another price. They try and keep prices low. And I understand that, but I do believe this product is worth it. Typically we just build it into the wound bandage package and it's like 35 bucks. And so owners will complain about a line item, but they won't complain about just a little bit more. But
No, but that's a good one because my dog came home with one of those on. They built it into, I think they built it into the cost. This was several years ago at this point. I don't remember. But it did make a difference because I was fully prepared for him to walk out of the hospital. This was a specialty hospital he was at with a fluid bag around his foot. And he came out with this beautiful cover on his bandage. And it was so easy to maintain. I'll be honest, I can't get the fluid bag to stay on the foot. Like,
yeah,
and
they're
I have no
tough.
idea how owners are doing this
Yeah,
with like Ziplocs and fluid bags and stuff. So I love that you bring that up. I think those do work really well, and there's no expiration date on them. So if you do
right.
any bandages, just if unless space is like a mega premium, yeah, if you can just put one on the shelf and have one in stock at a time, it's not like it's going to expire and you'll have to throw it away.
Right. And I also learned I'm from New Hampshire, so it gets cold. And those fluid bags freeze in the cold. Like they become rock hard.
Oh, I did not
And
know that.
so I didn't either. And then my family back home, their dog had to have dew claws removed and had bilateral bandages on the forelimbs and two fluid bags, and they just got rock hard in the snow.
Oh my gosh. Do they
Yeah.
like crack or they just can't walk in them because
They
they're
can't
rock
really walk
solid?
in them and
Poor thing.
they're just not bendy. Like it's really hard to like tighten them like you said already. And then you add the cold to it and they
Oh
get really
gosh.
hard.
Poor thing.
Okay. And then the controversial one that I don't use in my bandages that everyone does is I never use Elasticon on any of my bandages. I don't like the look of it. It's very adhesive. It leaves the sticky residue, especially at the top. On the bottom, I prefer waterproof tape myself because if a patient, I don't know, spills its water, drools all over the place, steps in something it's not supposed to, instead of changing the whole bandage, all the owner has to do is just wipe it clear. If it steps in poop, just wipe it off and it's good to go. And it just looks prettier. Back to that. It just looks a lot cleaner.
That doesn't sound quite as controversial to me as you might think it would because I have used Elasticon. I do use Elasticon, but it's not my favorite bandage material to
Yeah,
use because for a lot of the reasons you mentioned. And, God forbid you are dealing with a greyhound or something like that, and you like it can start to rip the skin
absolutely.
and be really painful, even with ease off and stuff like that. So it does give me probably, I don't know if it's psychological, if it's real, or if it's both, this like added security that my bandage isn't going to slip down. But does that all come from bandage technique of making sure it's tight enough that it's not going to slip down?
Yeah, I've never really needed to put anything at the top of my bandages. I understand wanting to if you're nervous about it. I'd rather the bandage stay on if you're nervous about something. But in my experience, I use tape stirrups on a lot of bandages. I just feel like it's sufficient, really. Typically, people are worried about increased friction sores or anything like that. As long as you're using the easy off with the porous tape, like you shouldn't have any problems. Or if it's still slipping, they can shave the hair. And so making sure your stirrups is attached to the skin, not the hair. The hair is nice and oily. It could still slip right off, even if you have that. So I found that that's sufficient in my experience. One of the things I hate the most is hearing the slogan, if it's a good bandage, you don't need any of that stuff. You don't need stirrups, you don't need tape at the top. Like,
Oh no, stirrups are like a non-negotiable for me, but that is a good reminder to use the porous tape and the ease off.
yes, please use porous tape
Yes.
if you are doing stirrups, but how disheartening is it if you say if it's a good bandage, it doesn't need stirrups or anything like that, and then you have a bandage fall off? Like,
Or you have toes swell because you put it on too tight, and now we have more problems.
so it's like it's stuff like that that I feel like it makes people scared to bandage. It's people saying that if it's a good bandage, it doesn't need that stuff. That's not true. Like you do what you need to do to keep the bandage on. Like so it's stuff like that.
That's a good reminder. So much gold here. A lot of things to keep in mind. I was always taught to do tape stirrups. Yeah, that would hurt my feelings if someone said if it's a good bandage, you don't need
Yeah, and
the
then
stirrups. I'd
it's
be like, it will for sure fall off.
I know.
Um, do you have a favorite bandage?
I love tie overs. I really do love
Sure.
tie overs. Just I love the challenge of them because, like I said, every wound is differently. So I've done tie overs that are next to a butt. I've done tie overs on top of a head, neuter dehiscence I've done, and you have to like factor in everything. Like, will this patient is probably going to poop on this bandage? What do I do to keep it clean and also like intact? I had to tie over an ear. I had to tie over an entire pit bull's chest because he got in a scuffle with a bobcat, like all that kind of stuff. So I like the challenge of tie overs and just making them work.
And just to think about a tie over, can you talk for a moment because this has changed since I graduated. I try to stay up and make sure I'm doing the right things. We talked a lot about like wet to dries and things when I was in school, and I understand that's kind of fallen out of favor. So when you're talking about a tie over, you're talking contact layer, gauze layer, and we're tying that on there.
Yeah.
Not we're not doing like a wet to dry technique usually. Is
Typically
that right?
not. Yeah, typically not. Usually, if you are going to do a wet to dry these days, I know we are moving away from them just because they are ripping away healthy granulation tissue, and you try not to do that.
Sure.
And usually, if you do a wet to dry, it's usually in the first like day or so. Like at once the wound has officially declared itself, you are trying to maintain that healthy granulation tissue and promote healthy growth. So at that point, it would just be contact layer, gauze. Some people like to use the blue drape, the sterile drape. I prefer to tie it over and then put a little circle of Ioban over
Okay.
top, and that's water resistant, super adhesive, and just kind of it makes it look. I've heard sunny side egg and I've heard a daisy is what it looks like with the yellow center. So again, it just makes it look pretty.
Do you ever like make it into an egg or make it into like a flower or something with tape or something?
I've definitely done a flower, like added a little like stem with leaves and stuff like that. Some might say I have too much time on my hands, but I just say I care about the patients. It might be both.
I love that. But I mean, probably like your day got better. I'm sure that the owner loved seeing that. And that actually beautifully dovetails into talking about the psychology of bandaging and, what happens when you do put that extra level of effort and you do bandage art or you make the tie over into a flower.
Yeah, so I almost had like an awakening within me. At first, I really like bandage art. I think it's super important to have on a bandage just because of the psychology of it all. Owners love it. It's fun to get creative with this kind of stuff. The owners take better care of the bandage when it's on there because they're like, we don't want to ruin it. Oh my gosh, it looks so pretty, kind of thing. But I actually got in a bicycle accident when I was 4 years old, and I needed a bandage from the tip of my toes all the way up to my thigh. So I'm okay, obviously, but I don't remember much from it. I remember it was painful at times, but I don't remember like little details except for one. I remember that I had Teenage Mutant Ninja Turtles all over my bandage, all over. I thought it was the coolest thing ever. I was so excited for every bandage change. And then I realized, oh my gosh, like if that's the only thing I remember from when I was 4, just Teenage Mutant Ninja Turtles, how are these owners gonna feel like when they remember their dog was in pain, their dog was healing, recovering, but all they can think about is they had a rose bandage art, a smiley face, something that kind of brought a little positivity to this stressful and scary time for them. And just to see that little bit of extra care, it goes an absolute long way.
That really resonates because a lot of times when we're doing these bandage changes, we may have to sedate or something like that, and patient's not always with the owner. Plus, there's like the scariness of just the reason that the animal is having to be bandaged in the first place, and a lot to worry about. And of course, there's you know the back, taking the pet to the back and away from the owner, and what are we caring for their pet, and are we being kind and doing the things that they would do? And it seems like when that little bit of extra time, I say a little bit, I've seen some of your bandage art. Like I imagine some of it is takes more than a little bit of time, but more time and effort is put into that bandage. I think it helps communicate to the owners what we really want them to know, that we do care about your pet and we are doing everything we can to, give them the best care possible while they're here, and we are giving them focus and attention and as much expertise as we possibly can to help them heal.
Yeah, and it's fun. It at
And
the
it's
end of the day,
fun.
it's just fun. Like I like reading an owner just like they're wearing a Boston Celtics hat. Big Boston Celtics fan. I'm gonna do a green bandage with a Celtics logo. It's Christmas time. I'm gonna do Christmas bandage art. It's the summer, big flowers. Like it's just fun to kind of just go with the flow, cater every patient to its recovery, and make bandage changes not a negative thing, but like I've had owners super excited to see what I'm gonna do next because it's fun. It's scary for them, it's expensive for them, and if I can get the dog excited to come to the hospital, that's a huge thing. But also just like the owners, I want them to again buy in and be comfortable trusting me with the recovery of their family member.
And I would imagine doing things like noticing a Celtics hat or little characteristics about the owner, like you said, reading the owner, and then coming out with something that mirrors what you read off of them also is very reassuring to say this person is paying attention. They're aware of what's going on. So they're paying attention to my pet, they're paying attention to me, they're making every effort. So we're not going to miss something and allow my pet to have a complication.
Yeah, I still talk to a lot of the owners that I've seen in the past because again, I'm seeing their pets for I don't know, 8, 10, 12 weeks sometimes. And so the relationship has to work. It has to be a positive one. They have to trust me in the recovery of their family members. So I will do whatever it takes to make them comfortable with me and make them leave with a positive experience and know that I did everything I could for their pet. And it's that goes for every single animal that I have ever taken care of.
I just want to like let that comment sit for a minute because that kind of owner experience, I think, is, I don't know if unique is the right word, because I think many of us care and we want the relationship to work, especially when we're talking about chronic management. But you just did such a good job of illustrating what a positive relationship this can be when it does work, when we are, paying attention and making this a fun experience. You mentioned making it fun for the pet to come to the hospital. And I'm sure if the owner is stressed out about bringing their pet to the hospital, the pet's going to read that off the owner. So if they can get excited, we can start to decrease that anxiety for everybody and give everybody a better experience. There's something when I think about vet med and a lot of what we're seeing right now, things are expensive and there's not a lot we can do to change that. So I always think about, well, how can we give people an experience that they value and they feel that they got what they paid for.
Right. Yeah, and it's so easy for us, like for them, from their perspective, they took time out of their workday, they took time out of their busy schedule to schedule this, to come all the way in and wait a while and talk just to talk to someone and then have the procedure done, what have you. For us, like we're here and I'm seeing 10 owners. So it's very easy for us to get in the mindset is like this is just another one, like
Hmm.
robotic, like moving on to the next one. But just changing your mindset and seeing it from their perspective, like this is a big deal for them. It might seem easy for us, but it's a very big deal for them. And so I want every owner to make it seem like, from my perspective, that it's also a big deal.
That it kind of naturally changes the mindset for us when instead of saying, oh my gosh, I have 10 bandages I have to do today. I'm tired. I didn't sleep well last night. And here we go. I got to do these bandages. Can I just do these and send these pets on their way? Do I have to spend a lot of time communicating and things? I'm just not in the headspace. Of course, that's going to happen to all of us from time to time.
Right.
But if we can, at least the majority of the time, shift that mindset to like, okay, I have 10 bandages to do. It's going to be a busy day. But what cool things, like what's going on? Like you said, is it summertime? Can I make a bunch of flowers today? And what color vet wrap do I have? Can I theme these? You've obviously had a lot more experience in this arena than I have. I'm not sure what I'm talking about, but it does seem like that shift in mindset to thinking from a general practice perspective. Oh my gosh, I have to do a bandage. That means I'm probably going to have to sedate this patient. It's going to take time. And am I going to have enough team members? And what if I get a walk in at the same time instead to say, all right, well, I have to do this bandage. I'm going to get some dedicated one-on-one time with my patient, and then I can make it kind of fun for me and the patient and the owner and let that be a positive part of your day.
Yeah, instead of I have 10 bandages, I have 10 opportunities to make someone happy today and to really make a difference in this family's recovery. And so it's just I always try and look at it that way. I try and look at like let's do some good today and like let's get it done. Like let's just knock it out.
Yeah, so I say I set out to help an animal today, and then I'll get, that case where I'm like, and I succeeded.
Yeah. Yeah, exactly.
Oh, at least hopefully every day comes
Yes.
back with at least one like that. Um, well, Brian, I'm really enjoying the conversation just around bandaging. I'm looking forward to digging more into briansbandages.com and Instagram and everything and learning more about the technical side of things. So let's take a minute and make sure we talk about where people can find you and kind of what they can expect.
Yeah, like you said, briansbandages.com is my main website. It has all the centralized information, but you can also find me on Facebook and Instagram. Those are my two probably biggest social media platforms right now. Trying to build up TikTok. I can't keep up with it. I feel like I'm 1,000 years old. And then LinkedIn and all that kind of stuff. But website, briansbandages.com, Facebook, Instagram is probably your best bet.
And what kind of things can people find there? Is it, are we looking for continuing education? Is it supplies, inspiration? What sort of information would people be looking for on those platforms?
Yeah, so I'm trying to just encompass everything bandaging. And so you can find there, you can sign your clinic up for a lunch and learn with me. Usually they're virtual. And I just go through several presentations on bandaging and make them fun, make them educational, and you just get to talk to me, which I love talking. So it's a perfect win. You can also find I have a video library that has all of my bandaging videos on my Patreon account. You can sign up for that, and I'm posting a new bandage every week. You can find I released a children's book recently about my story of growing up with a bandage and how it kind of shaped me to really want to take care of animals and make a difference. And so that was a lot of fun to make. And then I also just released bandage scissors, Brian's Bandages, bandage scissors that you can find there as well. So kind of, I'm never done. I'm always working on something. So I'm excited to be able to provide these things for you guys.
Yes, and man, couldn't we all use a good pair of bandage scissors
Yes,
that can cut a bandage more than 3 times?
absolutely. And they are very high quality, I promise. I use them myself.
Awesome, awesome. Well, I cannot wait to check those out. I want to thank you so much for coming on the podcast, for joining me and doing this episode. What did we miss? Are there any final thoughts that you want to share with people?
Don't stop learning. I know some days are hard. Like I've been there. I've had dark days too. Ask for help if you need it in any way, shape, or form. Like if you're having a bad day, just reach out to talk to someone. If you want to learn something technical, reach out to talk to someone. You can always message me if you want to just talk about anything or bandage stuff specifically. It doesn't really matter. I always like to be available and just talk through any troubles you might be having. So just never stop learning. Don't give up. Bandaging can be awkward and hard, and I'm here if you need me.
Ah, that's super encouraging. And I think it's such a good reminder that so many people with technical insight in vet med are out there and willing to help. If people did want to reach out to you, what's the best way to do that?
Social media, website, I have a chat thing, or you could reach out to my email, briansbandages@outlook.com. Just message me anywhere. I'll hopefully find it.
Brian, thank you so much. This has been such a great conversation.
Of course. Thank you so much for having me. Bye, everyone.
So I hope everybody is excited to go check out all of the material that Brian has put out there. Brian, thank you so much for joining me. This was such a fun episode, and I learned a lot, but also it kind of changed my perspective around bandaging and really kind of leaning into that psychology. So again, thank you so much for all the wonderful information. And of course, a huge thank you to everyone out there tuning in. I hope you enjoyed the episode as well, and that you're excited to go learn more about bandaging techniques and beyond. If you did enjoy this episode, please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content we try to put out there. If you enjoyed this episode, you can also explore more episodes by checking out the VetFolio website or listen wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes, so please feel free to reach out to me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassie DVM, or you can follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.